COVID-19, as we know, is defined as an illness caused by novel coronavirus. And since then, the use of vaccine has increased in both general population as well as in cancer patients. We believe that maybe the cancer mortality may increase as a potential impact of COVID-19 on cancers. So because of COVID-19 pandemic, some adjustments were made during the cancer care delivery. Many services were greatly impacted and delayed during this pandemic. Guidelines for vaccination in cancer patients. So these vaccines are extremely effective. I just want to make sure that everybody understands that these vaccines do not contain any live virus or the part of the virus. There are some side effects of the vaccination, and one has to keep them in mind. And one of them is lymph node enlargement. Now, the vaccines are available, it is safe. So get screened. It is safe to resume regular cancer care screening and care. Get vaccinated. Vaccines are safe, effective, and the only way out of this pandemic. And this is the end of my presentation. And with that, I would like to introduce Dr. Shiva Singhal.
The other aspects of cancer care that is coming in future will be cell-based therapy and epigenetic drugs using genes or genetics for treatment of cancer. I'll use melanoma as a prototype for modern immunotherapy that has changed the whole scenario, how we as oncologists, take care of our patients. What are those cancers where we can use this PD-L1 inhibitor? There are traditional cancer therapies and there are cancer immunotherapy. Now, when we were doing the traditional chemotherapy, what is the cancer immunotherapy principles? A little bit on that. The principle is basically the host immune system is dominant enemy that is faced by the developing cancer. What are the various organs of immune system in our body, which our body has multiple sites? Basically, the most important immune cell is a dendritic cell. And why is that important is because it takes the antigen and presents it to the lymphocyte or a kind of a white cell, which is called T cell. Most important cell is a T cell. When a T cell is activated, or T cell in general in our body, we fight our cancer cells every single day, or to fight virus or fight bacteria, and how it does it. Having said that, this was the basis how the immunotherapy works. But the problem also happens with immunotherapy, although there are less side effects as compared to chemotherapy, but there are side effects. The problem with these drugs is too much immune system. Immunotherapy is not about just the response rates, it's about long-term survival.